Thank you very much. All protocols observed, our distinguished guests, all the invited guests, all the participants, good morning. I would like to begin our session by appreciating the opening remarks from our two teams, representation from the Ministry of Health from the Kenyan side by the Chair, National Cancer Institute, and the UK part of the KUKHA by Dr. Graham Lord. Thank you very much. That has set the pace of today's meeting. As introduced, my name is Elias Melly, the CEO, National Cancer Institute of Kenya, who is one of the great partners in planning and execution of this meeting today. I have the privilege to have met part of the KUKHA team in the previous visits within the country, and I want to congratulate the KUKHA team for the great work that has happened over the last 7 years now. And already we have seen the fruits of this alliance between the two countries that have had bilateral engagements for decades. In the interest of time, I'll quickly give us a short overview about the cancer landscape in Kenya before I invite our panelists who are going to further engage and deliberate on this panel this morning. As mentioned by the chair of the National Cancer Institute, cancer is one of the emerging diseases in our country that has severely affected our healthcare system. And it did refer to the pillars of a healthcare system as guided by the World Health Organization. It is a disruptive disease that has affected all of us individually, as a community, and is now a global challenge. Hence the reason why we are here today, highlighting it as one of the major challenges that we have in our country and our region. It is one area that would require a multi-stakeholder, multi-country approach if we had to deal with this disease and reduce the burden. In one slide that I have this morning, I would want us to focus on this guy who is carrying this heavy load. And if you look at that load, it is too overwhelming. It reflects exactly what happens to our healthcare systems and what cancer is doing, among many other challenges. You will appreciate that in developing countries, we are still struggling with communicable diseases, the HIV, the malaria, the TB, but unfortunately, we are being hit hard with non-communicable diseases, and cancer is one of them. We know climate change plays a very critical role, in causation. And today and tomorrow, we will be having different topics that looks at cancer care through the entire continuum. From what challenges are we facing at prevention? What challenges are we facing at early detection? What challenges are we facing at diagnostics, treatment, into survivorship? And what strategies and intervention that can be anchored through KUKHA, so that after this meeting, we will be having very clear way forward on how the cancer ecosystem can benefit from the KUKHA, in our country as we learn from best practices from developing countries. Statistics, data do not lie. It predicts what exactly, is the burden. In our country, we have more than 44,000 cases of cancer every year. And this is data which is estimates from Globocan. I do believe that this data could be underestimation. And that is why the National Cancer Institute has taken a very robust strategy to establish the National Cancer Registry that is going to document the true burden of cancer in our country. I want to believe within the next 2 or 3 years, we should have collected every collectible cancer-related data in our country. The burden is so huge that our system cannot absorb it currently. If you look at mortalities, more than 29,000 cases every year. This is huge. And our major challenges is late presentation. Our major challenges is investment that would address the challenge through the entire continuum of care. The Ministry of Health has developed very robust policy which the National Cancer Institute implements. And one anchor document that we have is the National Cancer Control Strategy that has 5 pillars that informs how, as a country, jointly with all the stakeholders, beginning with our hospitals within the country, our academic institutions, our research institutions, civil society, we are looking at the role of our partners in industry, pharmaceutical companies. We are looking at international community, professional association, and different arms of private sector. We are coordinating this entire stakeholder team to make sure that after 5 years, we should be seeing changes in the statistics that I've presented here today. We are investing a lot as a country, and over the last decade, there is so much that this country has achieved, and we should appreciate the dedicated leadership from the Ministry of Health, from the government. Our president, he's more focused than never before to make sure that cancer is addressed comprehensively in this country. Prevention initiatives that we have will be dissected by the experts who are seated here today. In terms of investing in early detection, screening programs across the country, we are focusing on major screenable cancers, cervical cancer, breast cancer. Those two are actually contributing more than 60% of mortalities amongst our women. If we focus on these two cancers to make sure that we detect them early, we prevent them, then ultimately we are going to reduce the burden of women cancers by 60%. Prostate cancer, cervical cancer, esophageal cancer is one of the rising cancers that, if it is not treated, 90% of our patients will die within the first year because of challenges including malnutrition. And I want to appreciate the investments through KUKHA that has gone into research efforts to find ways of addressing this esophageal cancer. That as we sit in the clinic, I have the privilege to continue doing active clinical practice. And when I sat in my clinic this Monday, half of my patients were patients presenting with a diagnosis of esophageal cancer. Fortunately, most of these patients, because they present late with complications of nutrition and complications of getting quality treatment, we end up losing them. So as a ministry, as a country, working with all of you, including our partners, we are hopeful that the engagements that we've continued having through KUKHA, beginning with the programs which were led by Kenyatta University Teaching and Referral Hospital, can now be scaled up to the entire country so that the entire country can benefit from these programs. I know we have our academic institutions that are leading in research here. I have seen friends and colleagues from Egerton University, from Moy University, from Kisii University, and from our leading treating hospitals, national and county hospitals here. We are dedicated to make sure that we work as a team to make sure that we detect cancer early, to make sure that we diagnose cancer properly. The weakest link that we have in our entire cancer continuum of cancer care is diagnostics. We are at an era of precision oncology. We are at an era of biomarker-driven, interventions. If we had to treat cancer using either surgery, radiation, systemic treatments, novel therapies are now the key interventions in treating cancer. Nuclear medicine comes in. So in terms of treatment, we as a country are interested to make sure we onboard this in our institutions. And I want to believe that through KUKHA, since it's a Kenya-UK alliance, we should be able to make this as a reality as we move on. We are now looking into survivorship. There are patients that are now surviving because of improved investment that 10 years ago, they would die. There are patients through our access programs, they've been able to access current interventions that are life-saving, but there's still more desired to be done. And we are looking at this Kenya-UK alliance as one of the front runners in providing these solutions. We are also then looking at when patients survive, what challenges comes with survivorship. Breast cancer, cervical cancer, prostate cancer, they go through a lot of challenges. And at the heart of all this care we would like to improve, research plays a very critical role. Data is our new oil. And therefore, we would have to make sure that we use our data to conduct research that solves our local challenges. For a long time, we have relied heavily on foreign data. And sometimes this, underestimates or overestimates. And if it informs diagnosis or treatment, we may underdiagnose or overdiagnose, undertreat or overtreat our patients because we are using foreign data. This is the time when, through this alliance, we should have robust clinical trial sites in our country to conduct research that solves challenges that we have as a country. The only hope is through partnerships, collaborations. And this is one example that we are citing today. As I conclude my remarks, I am very hopeful and optimistic that through the investments that have gone into our country, we need to handle the quality aspects. Because if we do not address that piece, it doesn't matter how much investments that we put in place. And this is heavily dependent on our human resources in cancer care. So professional development, continuous professional development, additional training programs through fellowships, through PhDs, in basic sciences, clinical areas is very key, including training at the community level. As we implement universal health coverage, cancer is at the heart of it, and our focus is shifting from curative now to preventive. What are we doing in our communities with the support of including our community health promoters who are our first-level healthcare workers now in our country? So, ladies and gentlemen, I look forward to a discussion that is going to be intriguing, that will provide a lot of solutions. By the time this conference comes to an end, we should be sensitized more and we should be having a clear framework on how we are going to work between Kenya, UK, and other partners amongst our academic institutions and our treatment centers to make sure that cancer care is not going to be a challenge in our country as we move on. So, ladies and gentlemen, to further discuss this session, allow me to invite